All right, so just a quick disclaimer. Just because we're all very different, what works for one person doesn't always work for another person. So the discussion is really about helping each other find best practices, keep us healthy, active, and able to live our lives fully and independent. And so this is just really a judgment-free zone, and we only want to give everyone support to live freely and fully. Yeah. So there's just a lot of different ways you can be able to kind of control your life. So the idea is to really just give as much information as we can, and then hopefully people can find what they need. Why we have bowel programs for spinal cord injuries or neurological diseases. We don't have sensations of our bowels when they're full because of spinal cord injury. The peristalsis, which is the natural movement of food through the digestive tract, has been stalled because of less sensation. We're also sitting a lot longer. So this is where you get the compacted stool because we're not moving as much. So I know that exercise helps a lot for me to help get the bowels moving. Like the more I'm sitting, if I have a few days where I don't move as much or I don't get to go to like physical therapy or something, then I'm usually definitely compacted. So bowel programs, the main thing is to really be consistent. And then Lacey, I know you're really new to this, so this is the thing that really kind of sets you up for success, is really being at the same time every day. So I actually I work as a chemistry teacher, so my bowel program is 5 a.m. every morning. So I'm able to do it at 5 a.m. and I do it every day just because before my accident. And to be honest, do I get something every day? No, but I still do it every single day. Some people do it every other day. I think it's a little bit more common for people to do it every other day, from what I know with my other friends. Okay, so to be consistent every day at what time you're doing it really helps to keep the bowels moving, and that way it tells your body, like, okay, now it's time to void. So a list of the supplies that we need for the bowel program. Toilet bath commode with a hole in a bucket. So I really try to organize this to have it all right next to me. So I always have gloves. I do have a cheap website here. Honestly, gloves used to be $3.99 a box. Now they're freaking $10 a box since COVID. So, but this was a good site, but now they're a little bit more expensive. And then I do use the Magic Bullet. Sara had mentioned that earlier. They're a bit expensive, but for me, like,
they're worth it.
Yeah, but they really like work really well. So you can get about 100 of them for like $69. I try to get my insurance to cover it, but it doesn't. So, which kind of sucks. And then straight cath, hand sanitizer, trash can. And then I actually change my clothes on my commode. So, and also one way that, we'll get into that for a second. One way that I do my bowel program, and a lot of people, their bowel programs just take them like 2 hours. I do my bowel program in my shower. So that way what I do is I start the bowel program, I'll do the digital stimulation to get rid of any kind of poop in the canal, and then I'll put the suppository in, and while I'm waiting for the suppository, I will shower. Okay, so that way I'm saving a lot of time. So I have to take the bucket out because otherwise the bucket gets full of water. Every once in a while, not gonna lie, some poop gets into the tub. So you gotta be a little careful with that. So you gotta plan it right. Otherwise you end up with some poop in the tub. So, but that's how I do it. So that way it's faster. I'm almost always out of my bowel program within like an hour or so. So any questions or comments on that right now? We're gonna get into the medicine for bowel and bladder and a sheet that I sent you guys.
I just go to the toilet.
All right, so you don't use the commode at all, right?
No, I just transfer from my chair onto my toilet. I go ahead and do the Magic Bullet, you know, with a little bit of lubricant and a glove before I leave my bed. I wait for about 10 minutes and then I transfer to my chair and go to the toilet, and then I can take a shower after I'm done. But you save some time, but I'm so habitual that I was always a morning person before I had my accident, so it just came naturally to go in the morning.
Mhm.
And I don't know. I just don't think I could swing with any accidents in my shower besides peeing. It's just
I have a system. I have some gloves to pick it up and all that magic. So,
well, if you ever have kids, you'll find poop in your tub. And so I can say that at some point you'll see poop in the tub.
I think there's a lot of
I'm
people
over that.
Yeah, there's a lot of people that do put the suppositories in bed, and then they wait a little while and then they go. I mean, that's common, and that's why I'm saying like it's kind of different for everybody, and you got to kind of find like what works for you. So what works for me might not work for somebody else, and vice versa.
How long does it take everybody from start to finish on that?
I'm a little different because of the colostomy, but just because that question's posed and because I'm a proponent of it, it takes me about a minute and a half.
Oh, yeah, that's very nice and lucky. It takes me about 45 minutes to an hour.
Yeah.
And if I skip on time, then sometimes I have, what did you call it? A brownout?
Code brown.
Code brown.
Yeah. I like that.
And I only mention that because I cite my colostomy as one of the best decisions I made. And that was part of my problem, is that I was going at the same time. I was trying to get this routine going, and even with the routine, it wasn't working. And I would try for 2 hours to make sure, and 2 hours later I would have an issue.
Ouch.
So yeah, it was just, my body was a big old nope on the Bowel Program.
That's too bad, but if everything works for you, that's great.
When I did do the Bowel Program, I mean, other than my body not cooperating, the methods I used for anybody, Lacey, since you're pretty new, I actually managed to get they called it a Mariner chair. Some of you may know what that is. It's just a chair with a hole, the sanitary cutout, if you will. And it was on wheels. So I was able to wheel that over the toilet, do my Bowel Program, and then not even have to do a transfer. I could just wheel that chair right into the shower because it was shower safe. So I would do it over the toilet and then go in the shower. Sometimes bathrooms don't allow for that, but that was something that worked for me.
That's great.
Yeah. Originally, I had also the commode over the toilet for like an hour, and then I would go and take the shower. Like in the beginning, I was doing that. But then it was like 2 transfers for me, and that was in the beginning of my accident, and that was just like
exhausting.
Crazy. Yeah. All right, so I wanted to get into some medicines that are options for people. So I don't know if you guys were able to, I had this this sheet that we created for like bowel programs and how to like kind of go about troubleshooting for bowel programs. Did you guys get this in your emails?
No, I don't think I did.
Oh, that's because, Michelle, I sent you the Zoom link because you didn't sign up. So I'll have to send you the
Oh.
All right. So we created this, and it's like a chart. So originally, I found this thing where you can see how, because we all have like the different consistencies of poop. So it goes from like type 7 down to type 1. So type 7, okay, type 7, that's the one that's going to be in your bowel for the longest. Okay, so and then these are kind of actions you can take, because when you're at this point, you're already constipated. Okay, so one thing that I found, and I don't know if you guys have seen it at all, the Permalax, lifesaver for me, lifesaver. So now I don't have to take the stool softeners, and I was doing stool softeners, I was doing magnesium citrate, I was doing Senna, and I was doing like all of the things, you know, that we do to try to just get it out. So obviously if you have the pills, you might not want to buy more, but the only thing is with Pernalax, they're really like, they're pretty cheap. They're like $14 on Amazon for 100 pills. And I only take one a day. So that's like 3 months. So it's definitely worth the investment or something to try. It may or may not work for you because we're all a little bit different. But what's also nice about the Pernalax is it has a crease in it. So if you only take like a half of it, my friend that's able-bodied, she takes a half of one every day. So because she also gets constipated. So this really gets into, so say that your stool is really hard and it's separated, so that's been in your colon the longest. So like medications to correct the stool, you would take 1 to 3 stool softeners or 1 to 3 magnesium citrate. There's pills and then there's also the liquid. Usually the liquid just is like for like a serious clean out. But by the time you're at type 7, you guys know how it is. Like you don't feel good. Like the goal is to never get constipated because this can cause increased spasms, more reoccurring UTIs, low energies, negative mood swings, dehydration, increased nerve pain, and abdominal pain. So being constipated, I mean, it's not good for any of us. And the faster we can get it out, the better. And then it's trying to keep the flow. So by the time I'm at like type 7, usually I'm taking like 2 Pernalax. So I'll take 1 in the morning or I'll take 1, sorry, I do my morning program. So if you look at the time of day to take the medicines, so I would take 1 at 12 noon and then I'll take another 1 at 6 p.m. This is obviously something you kind of need to test out for yourself. But if I'm not doing the Pernalax, then I'm splitting the stool softeners and the Senna between 12 noon and 6 p.m. Okay, and then also food is a big thing. I get annoyed because doctors never talk about food and water and like how it really helps like the bowels. So if you drink, like if you're really constipated, my problem actually is the more coffee I drink, the more constipated I get. It used to be I'd have a coffee and I would be able to have a great bowel program. But now it's not like that. What I find is it's actually diverting the water away from the stool so that I'm just peeing a lot more, but then the stool is not getting enough liquids for me to be able to, it's just getting really hard. So if you drink 4 extra 20-ounce glasses of water, eat fleshy fruits and vegetables, take Metamucil, which is like a fiber. So this will also help you. And what happens with the fiber is it actually draws more water into your colon to actually soften the stool that way. Decrease or avoid dairy products, white potatoes, white bread, diuretics, and bananas. So if you look on the bottom, I got a lot of this information from the websites that's at the bottom. So your ideal stool, okay, so type 7 and type 6, those are where you're constipated. Your ideal stool is actually going to be at, I think it's 3 or 4. So you really want your stool to be at type 3 or 4. And then at this time, so the standard doses that you should be taking. So if you're wondering like, oh, I'm kind of regular, what would be my standard doses of the pills? So one Pernalax per day. So that would be at, so then I would take that one at 6 p.m. Okay, or 1 to 2 stool softeners and then 1 Senna. You always want to have a combination of the Senna and the stool softeners. 1 magic bullet suppository during the program. Typically, honestly, if I'm at a type 5, I'm pretty good. I'm not as bad. So this one is like a sausage, but with cracks on the surface. If it's coming out and it's like that, I actually feel pretty okay with it. Type 3 and 4, like that's the dream, but usually I'm at probably about a type 5. So then type 4 is like a sausage or snake. It's smooth and soft. I always feel like if I'm at a type 3, it's actually like kind of liquidy. But Yeah. So anyway, what kind of questions do you guys have about this?
I have a question about what Sara did. What kind of surgery did you have for your bladder? You said you had a sub.
I did, yeah. I don't know, Jenny, do you have?
Yeah,
a
well, we're gonna
bladder
do bladder
section?
next, Michelle.
Okay.
Michelle's
Okay.
trying to mess up my flow.
I'll talk about that then. In terms of all of this, I didn't see the chart right away, but we always like to compare poop consistency with food because it's what we do. So I had my my surgeon tell me that usually the consistency of peanut butter is desirable, which to me seems a bit soft, but
yeah, that's kind of how I felt about it too.
Yeah.
Yeah.
So is it easier if it's a bit hard? Because I've seen one woman, she actually posted a video on YouTube of her bowel program, but she had a special surgery where the more liquidy it was, kind of the better because it flowed out easier. Is it so? I don't know.
It
For
makes
me,
my stomach hurt when it's that consistency for me.
Yeah.
But
well, and it's just sticky. Honestly, it's hard to get out. I have
More
to like
messy?
digital stimulate a lot to be able to get it out when it's sticky, and it actually causes
Oh.
my bowel program to be a little bit longer because I use like, I don't know, 5 gloves to make sure that I get it all out too.
Okay, so if
That's
it's if it's harder, then it's easier to some extent.
I think so for me.
When I was dealing with it too, I
Alexa,
found
stop.
that the harder it was, the less issues I had throughout the day. So if I didn't
Right.
happen to get it all out, if I was kind of constipated, then I was pretty sure I wasn't going to have an accident.
Right.
It's a double-edged sword, unfortunately, because that also means like usually stomach pain, sluggishness, because you got poo
Right.
stuck.
Yeah.
So like the ideal consistency when you have a spinal cord injury, not ideal because it's just that much more of a mess and takes longer.
Right. Right.
So it's
Apple
kind of a lose-lose, really.
Mm-hmm.
Yeah. Yeah, I agree. Sorry, go ahead.
Oh, I was just going to ask a question about the Prunelax. Is that really harsh? Because some of the things they would give us, and my stomach would bubble real loud, and then I would have like violent movements with real messy, like you said. Is that like that?
It has Senna in it. For me, it's not at all, but I would recommend maybe for you to start with like a half pill and just see how it affects you,
Okay.
So that's what I would recommend. My mom uses it too. My mom has Parkinson's and she also uses it to stay regular. So
Okay.
it was like a godsend, no lie. Compared to taking like 3 different pills a day. Oh, amazing.
Mm-hmm.
I eat a lot of apples when I'm having problems because the pectin and the fiber from it seems like it really.
So you say problems as constipation or problems
Yes.
as diarrhea? Okay.
Constipation. No, the bananas are for the diarrhea.
Yeah.
You got to go on the banana, rice, applesauce, and tea for diarrhea. The brat diet.
The brat diet. Yep, I got that down here for that when you get the diarrheas. So, yeah. Okay. Cool. All right. So hopefully this will help people troubleshoot at least. And let's get back to the PowerPoint here. All right, so here's kind of what we talked about, and then here's the Prunelax. That's what it looks like. So Denise, if you want to order it, it looks like that. It's really cheap, actually, for what it does. It's like awesome. All right, so also some people, I don't know if this pertains to the people on this call exactly, but bowel program support tools, I wasn't able to reach the area. So there are things, digital bowel stimulations and suppository inserts. So there are ways to be able to reach if you can't reach. Also, I wanted to see, I'm recording this, but I can black you out for the recording because I wanted to put it on. So just let me know. I can black out the videos of people if you don't want to be on it. That's easy for me to do. Okay, so just let me know, because I am recording it, so that way the people that weren't able to make it, they can still get the information. Okay, so but I would just need everybody's permission to be able to put it up. If not, maybe I can put up the PowerPoint too. So I'm kind of new with all this, so trying to figure it out and trying to make sure people still get all the information. Okay, so we just went over the reference table. Michelle, you said you didn't get it. I have your email, so I will send you the reference table. Okay, and then we kind of talked about this. So is there any more questions? I think, oh, did we lose Lacey? Oh, we might have lost Lacey. Hi, Laura,
I'm still
welcome.
here.
Oh, you are.
Hi,
Okay.
how are you? I'm still
How
here.
are
Yeah.
you? Laura, do you want to do maybe a quick introduction? We were doing our names, what our disability was, and any problems we have with bowel and bladder, if you feel comfortable.
Sure, not a problem. I'm 65 years old. I've had my spinal cord injury for 10 years. I was in an accident on the T4, T5, incomplete. I've gotten where I can't really walk anymore and get to the bathroom. That's why I'm having such a difficult time. I feel like I'm always peeing all over myself, and I get pee on my chair, and even if I wear panties. So when I saw this, I was like, well, this is what I need to listen to other people that have a suprapubic catheter or some other thing to keep their skin clean. And so that's really why I'm here. It's mostly because I pee on myself.
Okay, perfect timing. We're about to just get into the bladder, okay?
Yeah.
Sarah, did you want to do any other things about the colostomy bag? And then Lacey, if you have any more specific questions, we want to make sure that we get your questions answered.
Yeah, so your questions here I can answer. I decided to go with the colostomy bag because it was presented to me actually, I think initially by my urologist. And then I had the term is escaping me, but the guy, because I had the two surgeons that did it, one for the bladder procedure I had and one for the colostomy. It was suggested to me by my urologist to maybe talk about it. So I did a lot of like soul searching because, I mean, a colostomy bag isn't exactly the sexiest thing ever, but neither is pooping your pants all the time. So I kind of weighed things out a lot, and I was spending so much time in the bathroom, and I felt like it was wasted time because I was still having issues on top of that. So I was so over it that I wanted anything to make my life even more normal. So I had it done going on 5 years ago, almost 6 years ago now. And I have not regretted it one single day since. So a lot of the complications I have is that, I mean, it's, appliance, like a plastic appliance that's stuck to your belly. So, with sticky things, as we all have probably seen with Band-Aids and such, it's not always a perfect system. So sometimes it does leak. I have had issues where I'm like, oh, well, it's all over the front of my body now. So it does happen on occasion. I would say in the last year, it's probably happened maybe 3 times. So as opposed to every day, I'm going to take that. And it's a lot easier for me to clean up since it's right in front and not having to lift or move or anything. I can just clean it up and away I go. My skin gets a little sensitive underneath the adhesive, but it's just something I've learned to deal with too. So all in all, it's one of the better decisions I've ever made in terms of my spinal cord injury. Can you feel
it? Your injury is kind of low, right? Can you feel the colostomy? You can. Okay.
Yeah. So your intestines don't inherently have any nerves in them. So like there's a pink stoma that sits out about that much, which is about 1.5 inches or so. And I have no feelings in that. If I'm really constipated, sometimes when it comes through my belly, I kind of get that like ew, ow. And otherwise, like, I don't get any feeling. Like, I still don't know if I have to go. I still don't know. Like, I can kind of feel like when warm goes into the bag, if I'm going. And I do have like feeling around that area of my belly. So if I do have like a rash or something, I do know. But ultimately, I think with all the complications I've had with it, super minor. They're a typical colostomy bag too. A lot of people that have like Crohn's and stuff get them, and they're able-bodied, so they'll get emptyable ones. Because I can't stand over a toilet and easily empty it, insurance covers single-use bags. So I'm able to, if it's full, it comes with disposable bags. So I just put it in a bag and take it off, put a new bag on, and I'm done. So like anytime I have an issue,
empty?
More so than I did prior to my
Okay.
injury, because with a colostomy, you do lose a good portion of your colon, in terms of its effect, which your colon and your large intestine are basically where your poop dries, like where your body leaches out the moisture of it. So I would say more often than not, it's looser. Very rarely do I have like fully formed stool, and I'm okay with that, because gone are the days where I'm feeling full and stuffed up and that gross constipated feeling that we're all really familiar with. I don't have that anymore, ever. I don't take any laxatives. I don't take any medications for any bowel regimen at all, since my colostomy. And so not only have I reduced the amount of time I spend in the bathroom, but ease. I think even if you don't have access to doing it yourself, like if you can't use your hands or something like that, your caregiver will have an easier time of doing things. Like I said, it's not the sexiest thing, but I'm dating somebody, so he doesn't care. So it's like I said, it's one of the better decisions I've ever made.
And then what about your recovery after the surgery?
I particularly had a little bit of complications after the surgery, because I had the colostomy and my other thing, which again, I'll talk about in a bit, done simultaneously. And surgeries went fine. They were very painful. I will say that, because you're getting your guts ripped out. I have a scar that starts at the top of my belly button, goes around and goes all the way down till about the top of the pubic bone. So they cut you open. And then of course where the stoma is, where they create a hole and pull up your intestines. So it's surgery. So I'm not going to lie to you and say it was cake. But the actual recovery from the incisions and stuff was like 2 weeks before I felt okay. I had complications called ileus, which is the paralysis of your intestines. Like I needed more paralysis, but it happened, which basically it just meant the peristalsis went away. So one of the things with surgeries now that they do is they want you to eat, they want you to fart and poop and get out of there. So they didn't wait till I did the farting and pooping part. So I got home and I just felt really, 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 really bad. Was vomiting, and I was vomiting up things that I'd eaten a couple days prior. So that was a big key to it. So I had to go back to the hospital. I got an NG tube, which is not fun. Yeah, it was just too much food too fast, and they shipped me out of the hospital too quickly is really kind of what it came down to. But
How many years ago was that too, sir?
That was about almost 5 years ago that happened.
So I would assume that it's probably better now, but
I would think so, because I've had significantly better hospital experiences from that.
yeah.
So yeah, all that to say, like, it is surgery, it is recovery, takes some getting used to, it takes some finesse, but we've all had to, dealing with spinal cord injury issues or spinal issues. So it kind of felt like cake after that,
Okay, Lacey, you have any other questions?
No, I don't think so. Or is it just your bowel, or did you have, both?
I had, I had what, if some of you may know it as a Mitrofanoff. So I have another hole in my belly where I cath through, which I can speak to that too, when we get to the bladder part.
Okay. All right, thanks for sharing.
Absolutely. And if you ever have any more questions, just get in contact with Jenny or me, and I'm real open about it. So I'll answer anything.
Awesome. Thank you.
Sure.
All right. So now we did that. All right. So this is bladder control. There's a couple things we can, that I found for doing kind of bladder control. I think most of us have a little bit of symptoms when it comes to leaky bladder. We had talked about it earlier during the introduction. Some of you guys have used like oxybutynin, and I use Toviaz. But some things that I think that people actually never talk to us about, and I actually just found this recently. So pelvic floor exercises that you could do. You can tighten the muscles you'll be using to stop urinating. It depends on your disability if you can even feel your pelvic floor. I've been getting a little bit of a recovery, so I can feel my pelvic floor now, where a couple of years ago I wasn't able to. So I do think I could probably do these exercises more, and I haven't tried them out because I just found it while I was doing the presentation. But I am pretty excited to try these. So you would tighten the muscles you would use from stop to stop urinating, and hold for 5 seconds and then relax for 5 seconds. If this is too difficult, start by holding 2 seconds and relaxing for 3 seconds. Work up to holding the contractions for 10 seconds at a time. Aim for at least 3 sets of 10 repetitions a day. So I'm kind of excited to try this out. So I don't know if any of you guys have tried that before, done any exercises at all for the pelvic floor. So
I have, but I'm guilty of being inconsistent.
we all are.
Things start going smoothly, and then you kind of think, oh, I'm not gonna,
Do physios like encourage you to do those, or do you ever do that with a physio?
You know, honestly, nobody has ever told me to do these, ever.
I had my physiatrist down here is so stupid. I love seeing Dr. Chen when I go to Chicago. She's so dumb. I said, do you think I could get into one of the pelvic floor exercise classes? And she goes, you don't need those. And I said something about swimming, and she goes, I wouldn't recommend putting you in the pool. And I'd already been at swim therapy at another, when I was with a different group. And so I ripped her on the review and told her she needed to retire. But
she doesn't sound very supportive.
No, she's not. That's why I go to Chicago. I'm in Peoria, so
yeah, I always say that they're on the No Hope program, so I stay away from doctors that are on the No Hope program.
Yes.
That's a good theory, I think, to live by.
Okay, so another thing you can do pelvic floor electrical stimulation, and just like Michelle alluded to, is that there are physical therapists that specialize in pelvic floor that have them in Chicago at Shirley Ryan. I've been to one once, but that's when my recovery wasn't as well as it is now. Now that I feel my pelvic floor more, I actually probably going to try to go back again and see if I can do some of the activities. Did I skip something? No. Okay, and then other options, we did already talk about this a little bit. Laura, I don't think you were here when we talked about this, but there is an option for Botox injections. Usually your insurance will cover it every 3 months for about 300 units. The procedure is always outpatient. And then also, so my friend, for some reason, her insurance wouldn't cover it unless they put her under anesthesia, which was weird. But wow. that just makes the recovery longer. The very first time I got the Botox, they did put me under, but and then I started going to Northwestern in Chicago, and now it's just outpatient. Honestly, I'm in and out in 15 minutes, like in my doctor's crazy. Yeah.
That's great.
Yeah, so, and it really works.
Did they lay you down flat to do that?
Yeah, I had to get on a table, and what they do is they have this like machine that goes in, and it has a camera on it, and you actually get to watch them put the injections into your bladder. I don't have sensation. I'll get a little bit of a reaction when they do the injections, and you can see like a little bit of blood. And then they give me like 1 pill of antibiotics when I'm done that I pick up.
And so what actually does that do for your bladder?
So what it does is it allows you to hold more, it relaxes the bladder. So when it relaxes the bladder, it allows you to hold more urine. So that way your bladder's not like spat. I'm not sure what your bladder does, but it just allows it to hold more urine. So that way you're not peeing and you don't have as much incontinence. So the first time I got mine, it lasted like 6 months. But then as the more I got it, I actually, it started lasting less time. So now it only lasts like 3 months now.
Oh.
Yeah. So, but that depends on the person. For for that, because it is like a toxin that you're putting in your body, and your body can kind of get used to it just like any other drug.
Right. Yeah, I think I'm looking for something a little more permanent than that.
Yeah. So, but I mean, these can be nice and it can be in and out. Laura, where are you at?
I'm in Santa Fe, New Mexico.
Okay. Okay. And then we had talked about this a little bit earlier, taking some medicines. And like Sara said, they will dry your mouth out. Like, and I'm a teacher. And when you have dry mouth and you're teaching, like, it is not okay. My kids are like, "Are you okay, Miss Kraft? Are you okay?" And I'm all like, just drinking water and like coughing and like super dry mouth. So I was on a lot of medicines before I started getting the Botox. Now I still do I'll take one pill of the Tobias just in the morning, and that seems to be pretty helpful for me. I've been on Inoblex before. Some of you guys had said that you have been on the oxybutynin. Yeah, so there's a lot of different pills you can take, and some work for some people and some don't work, and then they'll kind of go through the gamut with you.
Yeah,
Sorry, go ahead.
Dry mouth is not good because I get that really bad anyway.
I take the Mitrofanoff or Mitrofanoff, however you pronounce it, and it just seems like I'll go for days and not have accidents, and then I just call myself Mrs. Peabody, because one day I'm just like, I mean, I'll have 5 or 6 accidents in a day. And I don't know, I think sometimes that coincides with constipation though.
Oh, I totally agree. Totally agree.
You know, if I get constipated, then
but UTI is also, if I'm constipated, UTI, here it comes. Almost all.
I just don't get those. This is where my urologist was different. He put me on macrobed prophylactically, and I don't get UTIs.
Do you want to explain that a little bit for people?
Okay, when I had my injury 13 years ago, I'm a T10 and I'm 55 years old, and I was in really good shape and everything like that. But anyway, he gave me what is called macrobed, and it's not technically an antibiotic, but it's what they usually give you if you have a UTI. That's the first thing they usually give you. But anyway, he gave it to me. He said 1 in the morning and 1 at night. And I've had maybe 4 UTIs in this 13-year injury.
Yeah,
so,
that's insane. I've had probably,
you know, and if I feel yucky and that thing, I cath into a plastic bag, or into the toilet, so you can tell if it's clear or cloudy, you know, or if your urine looks or smells junky, you know, you better start pushing something. Yep. So I'll take a couple cranberry pills and just really push the water, but no, I don't normally get a UTI because I think the macrobed's worth it.
Yeah, I think I wanted to add UTIs to this, but I didn't know how much time I had. So and it's already like, we only have like 8 minutes, and I just want to respect everybody's time. But UTIs is definitely a topic that we're going to hit on later. But I want to get a little bit deeper into that, and maybe some other things that we can talk about, and like best practices that everybody has. Okay. And then there's some things that I've discovered and then I think we talked a little bit about this early on in the introductions. So I use the Depends. They're actually called incontinence underwear. They're the Depends ones. So it's like $35 for a 56 count. Those are the ones that I use. And then there's actually a reusable ones that you can use. They're about $22 each pair. I just recently found this. They're the Modi Body ones. So I feel like I waste so much ever since I got into this condition. It just drives me insane how much waste I create in the world. Being kind of a scientist and stuff, I just can't handle all the plastic I waste and all of that. But I've also learned to accept it a little bit. So, and then there's obviously options where you can just wear regular underwear and then wear the pads for the incontinence pads too.
So I did hear from an OBGYN that there are pads designed for periods and blood and pads designed to hold urine, and they're actually designed differently. So if you're having trouble and want to find a pad that works better, the ones designed specifically to hold urine apparently actually are different than the ones to hold blood.
Perfect. Thank you for that. Okay, and then, so I don't think pelvic prolapse, it can be a common thing in spinal cord injury. So there are actually some inserts you can get. I honestly don't know a lot about it, but I thought I'd leave it out there if for some reason anybody's dealing with this.
What is it?
You put them in, so you insert a small tampon-like disposable device, insert it into the urethra before a specific activity such as tennis that can trigger incontinence. The insert acts as a plug to prevent leakage and is removed before urination. The pessary, a stiff ring that you insert into your vagina and wear all day. The device is typically used in someone who has a prolapse that is causing incontinence. I've never used them. I don't know anybody that's used them. I just found it online, so I thought I'd throw it out there. Yeah. You know how it is, like people, I feel like nobody ever tells you anything until all of a sudden you see it and you're like, oh, that's a thing. So, Claire, do you know anything about these?
I don't, unfortunately. I'm sorry.
Yeah, no worries. All right. So, and then most of us do intermittent catheters. So, which is like between every 2 and 4 hours a day. What is recommended is that you cath around 500 milliliters. I have really heavy cath volumes that I kind of always have because I drink a lot of water. Mine's usually between 700 and 1,000. Doctors do not like that, but I have a large bladder and it's kind of always been like that. And then the better regimen, the less likely you have accidents. So for me, like when I was going to school and then I'd have a specific time I'd go to the bathroom, that is the best because then I usually don't have accidents. But now that I'm working from home, I've actually found it's a little bit more, because I'm not on as much of a regimen with it. Large cath volumes are also associated with urinary tract infections, so it's better to cath more often. Stay away from caffeine beverages or know how they affect you. Like if I have a coffee, I know that in 15 minutes I need to cath. Because I just totally, and I will have like 1,000 milliliters come out like right after I have a coffee. So just knowing your body really helps. Here, I just wanted to touch on some different catheters. I know Michelle, she casts, you use like Ziploc bags, don't you?
Yes, I do.
You're so
when I'm in, when I'm in bed or when I'm traveling, if I can get to the toilet. What are you laughing about?
I just think it's awesome. I would spill that all over the place. There's no way I'm gonna pee into like yeah, that's awesome.
Well, it's an actual zipper top. It's not even a Ziploc, but I have used those before. I've used all sorts of things before. My teacher said, "Oh, I'm not supposed to do this, but when I go out to the bars with my friends, I usually just cath into a beer bottle."
Yeah, I mean, if you can.
I said, "Well, that's good for you."
So for me, I have really like some kick-ass health insurance. So they actually cover these are chloroplast catheters, and the bag is connected. These are hydrophilic. Hydrophilic also are usually better to prevent UTIs than the ones where you add the lube to. And then there's also straight catheters. And then you would use these when you're cathing into the toilet. This one you would have to add lube to. The ones I have are also hydrophilic, but I know some insurances don't cover those. And then what I use, because I'm in India right now because my fiance is here, and it's really not accessible. So I actually insert my own Foley bags, but I change them every day. I don't leave it in for a week because I don't want to get a UTI, and I have nice insurance, so I will reinsert the catheter every day, so that I don't have to worry about, like, at night I'll take it out, and then I'll regular cath in the morning into a bag, and then I'll reinsert the Foley bag, so I have it all day, so then I can just get rid of the urine through the leg bag. So I didn't even know that this was an option when I started. Like, nobody was like, hey, if you want, you can like put in a bag sometimes if you want to go to a concert and you're out for a long time and, you know, there's no accessible toilets. Like, hello, I don't want to be in my house for, you know, I can't leave my house for 4 hours, you know, so because otherwise I'm going to like pee all over myself. So this is an opportunity. Long road trips, like I don't even have to stop when I drive down to like Southern Illinois where my family lives. I have like a 5-hour drive. The only thing I need to stop for is gas. I don't even need to stop to pee. I just put it outside the door, drain it out. It's fantastic. And then
so you actually insert it?
Yeah.
You actually put it in yourself?
Yeah.
Wow, I didn't know that either.
Yeah.
They discourage you from using Foleys now, even in the hospital, because they just don't like the infection possibilities with it. So Jen is the one that told me to YouTube doing that. And I've done it for trips now too, because of her. So it's her fault.
And do you find it useful as well?
What's that?
Do you find it useful as well?
It was useful. My daughter got married in Cleveland, which is about an 8-hour drive. And so that was nice for the drive because nobody had to stop for me. And I was my son was back from the Marines, and he doesn't really want to watch me cath. And I don't want to, you know, do gymnastics underneath a blanket while we're flying down the road. So that was nice.
Well, and I have on my way to India, I had a 22-hour flight, you know, like what am I supposed to do? Does that mean I don't get to go to India because I can't put a bag catheter in? You know what I'm saying? And that those were the options, you know? So, so that's when I started doing it. Of course, I don't want to do it all the time for just what Michelle said. So I don't leave it in for more than, I've done maybe 48 hours, but usually I change them pretty often. I only get 7 a month, so I save them for when I go to India because my insurance covers like 7 of them a month. Maybe they would cover more, but I get the other ones too.
If you don't have insurance that covers it, I've gone through lowcostmedical.com for getting my own. Because I was in a similar boat, like no doctors, nobody told me like, just grab a Foley if you're going to go to that beer fest or go, you know, whatever the case was. If you weren't going to be near an accessible bathroom. And nobody told me that you can get your own. Low cost does not require a prescription. They just let me get it. Because I suppose like if you don't need one, why would you get it?
Sarah, can you put that in the chat box for me? That website.
Sure.
Thanks.
Sure. I'm gonna look it up off to the side.
Sure,
but
or you can email it to me or whatever.
Yeah. Also it's important when you do order it yourself to not only get the correct Foley, get the correct size, get the correct French size, but also getting a Foley insertion kit is super important.
Exactly. So this right here on the right, this is your Foley insertion kit. You need to have and I have a YouTube video on here, which kind of, they're pretty intense. It's like in a doctor's office. They want you to be super like sterile and all that, but we're cathing all the time, so you can skip a lot of the steps. But it's a pretty good YouTube video. This is the insertion kit that you need. You need to have this syringe. And what happens is the syringe actually causes this little bulb right here on the Foley catheter. I don't think you guys can see here it is. So if you see the urethra, this is how it stays in the bladder. The little balloon stays in the bladder. So this is what causes the UTIs. This thing sits here and then the bacteria builds. So that's why they're kind of against it. But like I say, I change them a lot. But then maybe if you can get some through low cost insurance and stuff like that, then you'll be able to like do it more often. Like right now in India, I actually use one every day. So, and then sometimes 2 days in a row, but I don't really like to do it. And then, so you would strap it to your leg right like this, so that you want to make sure it doesn't pull too. Because if it pulls, it's pulling on your urethra, and this can cause you autonomic dysreflexia. So it's really good to like pay attention to the leg bag. On my wheelchair, I have a little basket under my wheelchair. So I just throw the bag in the basket under the wheelchair, so I don't have to worry about it all. A lot of people strap them to the leg and try to, and it can be kind of concealed too. So there's different ways to do it to kind of conceal it in different ways. For me, I just throw it on under the wheelchair, and I find that that works pretty well. And on the flight, what I do is I don't even leave my seat. I ask the flight attendants to give me like a large bottle of water. Well, first I'll buy a large bottle of water in the airport for freaking $10, whatever. And so I buy a large bottle of water, I'll drink it, and then I'll fill my own, I'll take the bag and then I'll empty it into that empty bottle. And then sometimes I'll ask the flight attendant, because it's better for them, because otherwise they have to put me in the aisle chair, they have to bring me to the bathroom, and honestly, I don't want to be going through all that either. So it's kind of a lot better to use it for that too. So any other questions about that? So, okay, so that's Foley catheters. I also, I actually invented these. It's called Ezzy Access pants. I wanted to go back to work, so I couldn't transfer like to the toilet. I wasn't going to take my pants off all the time. I mean, you just don't have time for all that. So I know that Michelle, she can catheter from her chair. I got some lady legs. So I got some thick thighs that kind of make it a lot harder. And I have really intense leg spasms. So I cannot cath from my chair. So what I did is I came up with the Ezzy Access pants. They have 2 invisible zippers. I'm actually in India right now talking to a guy to manufacture them. I'm hoping I can be able to sell the pants for maybe $20 to $30. I'm trying to get it to be more cost effective. Right now they're kind of too expensive to make, and because if they're like $65, nobody has money for that. So I'm trying to get them so they're actually more cost effective for people to buy. So anyway, I actually use these pants every day. Like I have zippers in every single pair of my pants. I can transfer to the toilet really easily, just unzip. I'm not taking my pants off all the time. So yeah, so I really love them, and I'm just hoping I can make them more accessible to people that need them and not at a cost that's ridiculous. Because there are other things that you can get. I know a lot of people, they'll just cut a hole in their pants and then just use the hole. But I mean, it's the whole taking off your pants every time and then dealing with my spasms at the same time that's a lot to deal with. So, any questions about that?
No, my phone's going to die and I'm not near a charger. Could I ask Sara about her
Yes, that's what's next.
surgery.
Go for it. We're on it.
Great.
When?
Sure. So yes, I had, some of you may or may not have heard about it, but it's colloquially known as the Mitrofanoff. It's after the doctor that created it. It is medically known as a ileocecocystostomy with an Indiana limb. So basically what they did was they took my appendix. Actually, they didn't use my appendix. They just took it out. I had a nurse say it's the healthiest appendix I've ever removed. So they took part of my intestines and created sort of a tube, if you will. And then they cut a hole in my belly. It's about 2 inches to the right of my belly button. And it's essentially a stoma. It doesn't stick out like my colostomy does. It's just there. It's open. I don't have to keep it covered or anything. And I can insert a catheter into that, and that leads into my bladder. So I can cath from my belly, which pretty much negates the need to transfer to a toilet, which pretty much negates the need to take off my pants. I just carry like a soda bottle or something with me at all times and just cath into that, dump it out, and away I go. So reasons I got this procedure was for sake of ease. Not, it was, as we know, even accessible places aren't accessible. So it just kind of made things a little more easy for me to kind of get out in the world and not be so afraid to get out in the world. Also, as a part of the surgery, I got bladder augmentation done. So they used part of my intestines to make my bladder bigger. So having a larger size bladder also kind of helped prevent bladder spasms. I still get them if it's too full. But I like Jenny, I can hold quite a bit of urine before it becomes a problem. And I can still, like the traditional way to cath, I can still use that access. They didn't close that off or anything, so I can still cath urethrially as well for whatever reason, if I'm in the shower, or I don't know, if it's just more convenient. But either one is just as fine, and both of them get empty out my bladder just as well. I would say it probably hasn't cut down on my UTIs. It's more or less just made my body used to a level of bacteria that's always in my bladder, because that tends to happen when you cath. So I do get like cloudy and sort of odorous pee, but it's not necessarily an issue. And like I said, my doctors are hesitant to treat it oftentimes because I have such antibiotic allergies. So it's like, they're like, if it's not causing you any problems, we're not going to deal with it. Okay. So yeah. And it doesn't have, I would say it comes with its own issues. Like when I'm full and I have incontinence, I will leak out of my belly. So I have put like a pad underneath my pants just to kind of block from it. I would say not often. It has overwhelmingly helped a lot of my incontinence issues. I would say the only time I usually have incontinence problems is because of my own stupidity, that I forgot to cath. So that's usually my issues, is just that I don't remember to cath because I just get busy doing stuff with life. But like, if I cath every 4 hours, I would say I never have leakage issues. So I think that's a combination of just having easy access, but also the augmentation. The augmentation helped prevent spasms. And I take no medication for my or bladder regimen either. So like I'm on 0 medication for bowel and bladder largely because of the 2 surgeries I've had. So I would say the other issue I have with it is because they use part of my intestines to create the tube. It does create thicker issues, thick pee. Your intestines don't stop creating the mucus.
Weird.
So yeah, so I've likened it to, this is again, food. I've likened it to sort of egg drop soup. So it gets it gets chunks in it. So that inherently causes an issue with Foley sometimes. I've used them and they've just gotten clogged. So there are medications you can take to prevent the clogging, but it's never an issue. I actually use 18 French red rubber catheters, male, the big long ones. And that's just because it takes that much sometimes to get down through my belly. But with that, it's just made my life that much easier. I bought a house a couple of years ago. I've never sat on my own toilet ever. I've never had to, because I have the colostomy and I have the catheter through my belly. So I've never had to sit on my own toilet. And I think between the 2 of them, like I said, they're not without their own issues, but the issues are so minor compared to what they used to be that I would do it again in a heartbeat.
That's good to hear. I thought about the bladder surgery. I don't think I have enough problems for a bowel problem, bowel change. But, but the bladder thing is interesting.
I like I said, I would definitely recommend it. If I'm too full and like I bend over to pick something up, well, then I'll leak out my urethra and that's a problem. But sometimes at night, if I drink too much during the day and I'm not careful and I don't wake up in the middle of the night, which I never do. I never wake up in the middle of the night to pee ever. I would say sometimes there is leakage in the morning, and it's usually through my belly, so I sleep on a pad. But it's totally worth it. Like I drove to Michigan with a friend, which is just an 8-hour drive for me from Madison, and I didn't get out of the car once. Didn't have to. Just peed in a bottle, dumped it out the door, and away we went. So it just limits transfers, limits dangerous transfers, limits, the accessible inaccessibility. I totally recommend it.
Laura, did you have any other questions? Because I think maybe this is really something you were looking into.
Yeah, what I'm wondering is when y'all have to get the catheters, you get that through Medicare?
I do have Medicare. I also have a gap insurance too, just to cover everything because I've had my fair share of medical issues. Medicare will cover them.
Okay,
A lot of times
but
they're 80%, so I do recommend a gap coverage, but for the most part, they
you-
do cover it.
Do you have to is that on the drug plan where you get your medications, or just regular Medicare?
It's just regular Medicare. You don't, it's
Okay.
not Part D, it's Part A, no, not Part A, Part B. Excuse
8B.
me. Yeah, Part B.
Okay, that's good. That was the other thing. No, that was really interesting because that's what I was interested in. And if you can swim when you have that.
Yes. Yep. Yes. Absolutely zero issue. Actually, that's how I met Jenny, is we go scuba diving together.
Is there like a little valve or something you have to put in that stoma?
There's no need.
For the...
There's no need for it. It just kind of hangs out. Like it's not gonna like seep in water or anything because it stays pretty close. Like the way they kind of created it, it sort of acts like a sphincter almost. So it does close itself off. And it's fine. It's magic. It's medical magic.
Yeah, my primary made me an appointment with the urologist, and I have one appointment this month. So I'm going to go and see. Now I feel like I'm educated enough that I can go in there and talk about what I want and what I need.
Mm-hmm. The surgeon I had is kind of the main guy here in Madison. Like he's known for it. So when I had initially heard about the Mitrofanoff, I thought, oh, cool, like a little stoma in my belly button. Which is kind of usually how people typically hear about it. For me, he said in the belly button has caused a lot of problems. So they've just moved it, like I said, 2 inches to the right of my belly button. And it's just a tiny little thing about the size of a dime on the side of my belly.
Oh, that sounds like it. That you gave me a lot of good information. I really appreciate it.
I'm happy to answer anything and everything. And I'm, like I said, I totally recommend it. It changed my life for the better.
Okay, well, thank you so much for
You're welcome.
sharing with us.
I wanted to tell you guys that I changed catheters from a 14 to a 12, and I got a case of low fric hydraulic 14 French catheters that I want to give to someone if they need them, because right now I don't want to fill the landfill with a case of catheters if somebody could use them.
Well, I use the 14s. Are they clear? Are they plastic?
Yeah, they come in a little pouch, and you squeeze the pouch, and that gives the hydro. So they're pre-lubricated, and then you can take it and you put the catheter back in the pouch, and you seal it off, and you just throw it in the garbage.
Oh wow. I would probably have to pay you for the shipping on that.
No, I could send them to you. Jenny,
That's
could you
great.
Yeah, I can.
forward her my
I'll
email?
send you guys an email. I'll send both you guys an email and copy you guys on it.
All right,
Okay, thanks. You're welcome.
Is there a reason why you went from 14 to 12?
For comfort, it was some reason that the 14 felt like it was a little harsh when I would insert it, and when I pull it out, it felt like I felt a discomfort, almost like something was pulling. And so I had went to a I think it was the vet games, the VA games, and they have the vendors there, and the other people asked me if I would try one of their products, and so they sent me a 12, and I tried the 12, and I said, this feels a lot more comfortable to me, so I just switched to 12.
Yeah, it's always interesting. I feel like they just tell you it's 14, but you never think about trying a different one. That's cool.
Yeah,
I
that was the
tried a
thing.
12. I liked the 12 too, but they just didn't have a long enough one in the hospital for me to use. So if you've got long ones or bags, then you're good. The 12 is more comfortable.
Yeah, I want to apologize. We're going like way over time, but I think everybody's getting good information, so I feel good about that at least.
And we don't want to hear about India at all.
Okay. No problem. Well, I was quarantined for 2 weeks, so I'm here with my fiance. I didn't see him for 7 months, so now we're celebrating our time together, just enjoying being together, so which is nice.
And socially distanced, you did, right?
Oh, of course, yeah. We definitely didn't touch each other for 2 weeks.
Okay.
Don't worry, Michelle.
All right. I have faith in you.
Yeah, right. I wouldn't. So this is actually, we're about at the end. I wanted to open up. I actually just made a Facebook support group on Facebook. It's Warriors on Wheels. So we can continue the conversation. And if you guys want, and then if there's more questions or you're like, hey, is there a link to this? So that way we can keep sharing the information, because it was a lot of information. And then you're like, oh yeah, we talked about that. Or you run into a friend that needs help with something and be like, oh yeah, we talked about that. Let me give this reference. So if you guys want to do that, that would be maybe our challenge. So the idea is at the end of each meeting was we kind of try to take on challenges to help make our lives like more independent. And maybe that challenge is like supporting other women or men, either way, you know. I actually had this open for men, but no men signed up. So I was like, all right, well, that's fine. Because I had a men's group that would go on at 8 o'clock after, but nobody signed up for it, so that's fine. So that would be great if you guys want to sign into that, so then we can keep going with the conversation, and feel free to invite people. We do have more meetings coming up, and if you guys want a specific topic, I'm really open for suggestions. I actually don't remember what the next topic was. I do really want to get into urinary tract infections and talk about those and like best practices and different things we can do to help people deal with urinary tract infections, to get to kind of the other side of that. So I just want to thank all of you guys for coming. And then again, please send me, if you want me to black you out for the recording, yeah, can you send me an email so I can black out yours, or just raise your hand and I can black you out? Okay.
Black me out. I look horrible today.
Okay, perfect. Will do, will do. Thank you. So it's all about just trying to get information out there. And then the only thing is like I could just do a video and just have my face, but it's, you know what I'm saying? It's like I don't get to see people. So, but I have, my fiance is social media master of the world, so he knows how to do everything with videos. So
you will block me out, please, right?
Yeah.
I was on mute. I'm sorry.
Okay, yeah. So Janine and Michelle, yep, perfect. Will do.
The Botox, as you saw on me earlier, needs to go between my eyebrows, not on my bladder.
Oh, okay, I get it. I was a little slow on the uptake. Got it.
Oh, okay. I could put my picture back on, and then everybody can see that.
All right, great. All right, thank you, ladies, for coming. Also, the website that I have, it's projectawaken.us. If any of you guys are interested in different virtual workouts, I have a whole calendar set up there. If you want to try to get active while you're still at home, they're for all abilities. So I'm getting more organizations wanting to add their events. So if you're interested in that, that's also on there. All right, but thank you so much. I hope you guys learned a lot, and it's going to help you become more independent in life. Sarah, really thank you for being here and giving so much like information and education to everybody. It was amazing. And Claire, thanks
Thank
for
you.
attending.
Oh, thanks for
Thank
inviting
you.
me. I really appreciated it. And thanks
Yeah.
for hosting as well. It was great.
All right, great. All right, ladies, have a wonderful evening.
Thanks.
You too.
Bye.
Bye.